Hey, welcome everyone to the April Jousse lecture. Just a reminder once again that this lecture is being recorded, and we have recorded previous lectures, and they can be found on the KITE website if there are other topics that you are interested from previous Jousse lectures. I'm delighted to introduce Dr. Sussan Askari today. Dr. Askari is an assistant professor in the Department of Physical Medicine and Rehabilitation at Queen's University. She's also the medical director of the Spinal Cord Injury Rehabilitation Service and medical lead for Spinal Cord Injury Implementation, Evaluation, Quality Care Consortium at Providence Care Hospital. She is the PM&R Residence Training Program Director as well. Dr. Askari completed her PM&R residency training and spinal cord injury fellowship at Dalhousie in 2013, and she is awarded a certification in lifestyle medicine by the American Board of Lifestyle Medicine in 2021. So not surprisingly, the title of her talk today is Well-Being is Not a Concept, It's a Skill. I look forward to the talk, and Dr. Askari has told me that she's okay with questions throughout her talk, so feel free to raise your hand or type the question in the chat. There will also be time afterwards, after the presentation, for additional questions as well. So if you prefer, you can also save your question to the end of the talk. So without further ado, I would like to welcome Dr. Askari and look forward to her presentation today.
Okay, thank you very much, Brian, for a kind introduction. And hello, everyone. Let me just share the screen here. Okay, get started. Just wait a second. Bring this back.
Yeah, it was partially my fault because we had to go through all the slides.
No worries, no worries.
Order.
Thank you very much for inviting me, and I'm delighted to talk about this topic, which I think it's important, and I hope that I could convince you the importance of that to consider for our rehab population. We are going to learn about why we think that well-being is a skill. Okay, so the objectives for today, we're going to talk about well-being, the pillars of well-being, 4 main dimensions, and also look at the framework and the science behind it, and review some evidence about resilience in spinal cord injury population, which is not huge. And the program that we have started here running at Providence Care Hospital over the past couple of years or so. Perhaps some of you or all of you think like why some people are more resilient than others, and particularly when events such as a spinal cord injury, which is a catastrophic event, happens in life that has a big toll on physical and mental and health and function of those individuals. And it's important to think about what well-being is. So by WHO definition, well-being is a state of complete physical, mental, and social well-being, and not just absence of disease. What it means is that we pay attention to some of the factors or risk factors for our mental health, but which usually those are towards the negative outcomes, such as depression, anxiety. Not that they are not important, definitely they are, but we also need to pay attention to some positive attributes of human characteristics, such as compassion, kindness, and mindfulness. In terms of when we talk about well-being as a skill, how we can achieve a skill. The way that we can achieve that is by two different kind of learning, as you see here, like declarative learning, procedural learning. So what declarative learning is mainly value learning. When we talk about, for example, knowledge or education about mindfulness, doesn't make someone mindful, or talking about kindness doesn't make someone kind, or honestly the same. Like those values, you just cannot be that kind of get that quality unless you have some other sort of learning, which is procedural learning or skill-based learning. So we know that we can achieve the skill by practicing them and training those skills that we can get to as a routine. And there are different parts of the brain, as you see here, involved in those two different learnings. And which again, on the skill ones, you see the frontal lobe is involved, and also basal ganglia, which is involved for our behaviors. And for declarative or value or fact learnings, it's mainly temporal lobe or hippocampus, which is also involved in memory. And so again, kind of to know why well-being is important in the first place, which is even more relevant since COVID happened, is the rate of depression, anxiety, loneliness, suicide, all those things kind of increased since COVID. Like globally, all of them were rising, and even accentuated with COVID. And what happened at the beginning of the COVID, as you know, like announced by public health to get people social distancing versus promote them with physical distances, which made the situation even worse. But what we know now, or more modern science figured that about those qualities of well-being is some of those four themes that I'm going to talk about. One of them is neuroplasticity. And perhaps many of you heard of that, which is our brain constantly change and shape based on experiences that we have from outside, or that we get on our daily routines or daily basis. And the challenge is, though, it's not necessarily always those experiences are the great one. And sometimes it's our brain, it just unwillingly, our brain gets forced by external factors, which we may not be in favor of, or not good for necessarily for our mind. But we can train them. So by training, for example, mindfulness, intentionally training that, we can shape that changes or the connection in the brain that would have impact on our the other part of our body. And by practicing that, those qualities can endure during life. The other part, the theme of modern neuroscience is epigenetics, which over the past few years talking about how that our genes are regulated. And we know that all of us have a pair of DNAs which are not changed throughout our life, but what it changes is to how to get those genes turned off and on. And it's like having a volume for that to make changes. And like the setting of the volume can get changed by very dependent, highly dependent our demeanor and emotional life. And studies show that if the way that a mother behaves toward offspring can actually pass on, can remain for that offspring and also pass on to one or two generations. So it is important, and those changes can persist. The third theme is mind-body connection, is one of those things that I believe now medicine is coming into, and hopefully in future we see more incorporation in medicine. But there are bidirectional effect of our mind to body. What our mind does affects our body, and again, the activities in the body affects our mind. And just picture shows some of the, like when we are under stress, how our body responds. For example, our blood pressure goes up, our pulse rate goes up. And the same when we have sort of feelings in our body, we're tired, or we have change in our gut, for example, that also affects our brain, or inflammation that can cause, again, effect in our brain. The fourth theme is innate basic goodness, which what it means is human beings are coming to the world with propensity to goodness. And if they have a chance, they would kind of choose towards the qualities that some of the prosocial behaviors, such as kindness, compassion. And it's not that people have that kind of towards anger or sadness. Those qualities or negative emotions are not necessarily we born by those feelings or experiences. But what happens if we can look at this the same way that scientists look at language, for example, if a kid kind of live in or grew up in the wild, probably would not get the language, would not develop as should it be. But if that person be kind of in nurtured environment, definitely that would happen. And the same as kindness or compassion, those are the seeds that it's within us, and just need good environment or nurturing support and with the family to kind of enable to express those feelings. Now there's a center in it's called Healthy Minds Center, which they do cutting edge research in area of kind of looking at those positive qualities, and they switched their gears maybe over the past several years based on they're being challenged that you have the tools to look at depression, anxiety, all those negative emotion. Perhaps you can do more and do study about kindness, compassion, and empathy, those sort of emotion that may have positive impact on people's health and behavior. So this article published in 2020, and they looked at the plasticity of well-being and how the framework that they proposed can work around and the skills that they have. So the four pillars or main constituents of well-being that they propose is awareness, connection, insight, and purpose. So we're going to touch on each of them, and it is important to know that mindfulness, which goes with awareness, it is very important part of well-being, but it's not the only one, but it definitely is one of the bases to get the others. And it's, again, awareness goes, when you talk about paying attention, which is non-judgmental, that definition by John Kabat-Zinn, which is pioneer in mindfulness meditation, being in present moments. And we have that kind of, our brain has capacity to have attention, but also our brain has capacity for meta-awareness. So what meta-awareness is, when we have, for example, I'm sure that people have had that experience. I definitely had. When you're reading a book, you're reading like 2-3 pages and just you don't know what you're reading. And at the moment that you get that sense of what your mind is, this is kind of a meta-awareness, and there is a kind of neural pathway for that. And then self-awareness, again, knowing what you are, what your body or your mind is part of this practice. And they did an interesting study in years ago, that was from 2010. And in 5,000 people in 83 countries. And what they found was 47% of the time, our mind was kind of not paying attention to what we are doing, like just wandering mind called. And research shows that distraction is kind of one of the qualities of lower well-being. So when our mind, the wandering mind, that's the title of this article, a wandering mind is an unhappy mind, which is true. And that was interesting. And what also we know, the link between distraction and how that can impact our executive function, and resulted in stress, anxiety, ADHD, and depression. So what they did in a study in 2011, I believe that is from Germany, that they looked at anatomical MRI and see the areas of the brain changes in those were 16 healthy individuals with which were meditation naive, and they trained them to do mindfulness. That's MBSR, mindfulness-based stress reduction program, which is specific ones that they get like almost total of 26 hours in 8 weeks. Those are kind of weekly sessions, and then includes also practicing that. So what it showed is that there may be quite small, but you see the colors like yellow and orange, the changes in hippocampus, and I showed before like that areas, and actually more areas, which this is just showing this area, but the neighboring area, like the cingulate gyrus, the temporal parietal junction, some of the areas that is involved in our attention, that is changed, and the concentration of the gray matter. And they're again, they show that participation in the MBSR associated with change in gray matter, and which in the areas that related to memory and emotional regulation. There was also a study, I didn't put it here, but also studies show that mindfulness would impact or increase the white matter as well, concentration. There is, so there's a study looking at default mode network. So when we do when we focus on or paying attention or doing a meditation, this default network is kind of the activity would reduce. And the job of this network is, because our mind or brain kind of are always wandering, not always, most of the time, as that research showed. And so that's when we are waking and we are in past, in future, and not in the present moment, that network is working. So what happens, they did a study on those people with like the monks, for example, that they have thousands of hours of practice. They showed that this activity and in this network not only reduced during kind of the time that the mind would maybe wandering, but also when they are focusing, that's vice versa. Not only when they are doing meditation, this kind of network is working less, but also when in the mode of wandering, this activity is lower. So what it means is that they have kind of lower set for this network, which is interesting. That the study was from Yale University. So this is just, I put this study in 2018. They looked at internet delivered mindfulness for people with depression and chronic pain with spinal cord injury. That was not the biggest study. They looked at 36 people that they put this on the intervention, doing mindfulness, and those mindfulness was, and duration was 8 weeks. They did 2 10 minutes of practicing mindfulness online, and also psychoeducation in the other group. And they looked at depression, symptom severity, and also anxiety, quality of life, pain perceptions, and mindfulness. And also they looked at those data at the beginning of the time 0 at completion at week 8, and also 3 months, week 12. What they found that was mindfulness group had reduced depression significantly compared to the other group in both 8 and 12 weeks. Anxiety and pain and pain unpleasantness and significantly reduced compared to the control group, and mindfulness score also significantly was higher. And those, the things that kind of maintained and longer term was reduction in anxiety and catastrophization. Now let's talk about the second pillar of well-being, is connection. So connection, when we talk about connection, is referring to care and kinship towards others that promote a supportive relationship and interactions. And the way that those skills can be trained is through appreciation, kindness, compassion. So again, like perhaps you hear like sending gratitude, having gratitude journal, what you're grateful for and the reason why you are grateful for. That shows, research shows that is more effective and impactful, that you tell the reason versus you just say, okay, what you are grateful for. And like kindness, as we talked, they did a study in 7 hours on kind of university students for 2 weeks, and they showed the change into altruistic behavior and compassion, which those are the skills can be learned and practiced. So why this is important? Because social relationship has had higher predictor of health compared to like your age, sex, and race, or other economical factors, and even with like blood pressure, diabetes, like those, like social relationship is the most indicator for health. And again, positive relationship is vital for healthy psychological functioning. And if that's true, imagine if we can change our mind by the way that improve our physical health, then which research shows reduces cardiovascular disease, diabetes, all those things, then would impact people optimal health and reducing hospitalization cost, and like also would have financially beneficial or economically beneficial as well. This is showing they did a study through, again, functional MRI, looking at the different areas that when they compared compassion with empathy, which when we are like, if someone is suffering and we are sharing that suffering with that person, that goes with empathy. But if you think of compassion is when you are kind of sensitive to the person's emotion, but you strongly motivated to care for that person. And it means that care with, not care for. So that's kind of the difference, and showing that different areas of the brain will be involved, and more areas when you have compassion, like for example, orbital frontal cortex will be involved, cingulate gyrus in cortex will be involved, and like putamen that showed in the middle here. So it's interesting, again, with particularly the application of this could be in healthcare provider, as we know that lots of impact, particularly since COVID, and what all of us in the healthcare system dealing with, and if we have some tools and strategies to improve those qualities that help our emotional well-being. And I forgot to mention at the beginning of my talk that I'm so excited that this emotional well-being recognized by SCI Consortium that started by Dr. Craven and Dr. Wolf leading this in the country. This emotional well-being recognized of one of those 6 domains that need to pay attention to. And again, looking at when we say connection is important, or social support, loneliness could cause adverse health effects. And that study just recent 2023 that showed, like, they followed up for 20 years, and 4.9, almost 5% of the participants developed type 2 diabetes, and almost 13% felt lonely. And they found that the people who felt most lonely, that 2-fold higher risk of having type 2 diabetes compared to those that were not. The 4th pillar of well-being is insight. So when we talk about insight, it means that our thoughts or senses and internal cues that we have for ourselves, or maybe narratives that we carry with ourselves, and usually those narratives are not a good one, because our brain just has tendency to stuck on the negative ones. And studies show that rigid and negative beliefs linked to kind of adverse outcome, psychosis, depression, and on the other hand, compassionate, accepting, growth-oriented beliefs can help people to thrive and reduce lower level of depression, anxiety, and optimal well-being. The 4th pillar of this framework of well-being is purpose. And purpose means, like, to have sense of direction, but that sense of direction should go with be aligned with the values, or mostly core values of the person. And this also showed that it's very kind of important in terms of one of the most indicators of longevity, and it associated the people who had kind of purpose in their life has less emotional reactivity to negative stimuli, and their brain responds better when they are dealing with kind of the fight and flight response, that the areas of the brain like cingulate gyrus that has kind of increased activity. But in those people, if you have sense of purpose, that activity would increase, but also the amygdala will reduce the activity, which again, that is those areas are important when we are dealing with a sense of fear and kind of fight or flight response. And when we talked about purpose, what they talk about, that whatever you do, try not to have kind of your aim or goal as not every day like something big, or just try to infuse it in your daily life. Even like washing dishes could kind of think of the way that, you know, I'm doing this because of that, or like a bigger picture of, oh, I'm doing this for my family, or some of those just the act or activity that you do in your daily life. Just get back when you get frustrated, particularly think about what are kind of other chain or the beginning, where does it go? And if you align that your values, particularly when you're facing with challenging situation, that why you're doing this, that would be helpful. I can tell you about my purpose when I immigrated to Canada years ago, and my son was born in Canada, in Toronto, and I had to wake up very early in the morning for study before he wakes up, and my purpose always, I was telling me, oh, I'm doing this because of my son. Kind of that helps me to go through a very difficult situation at that time, and I think that is important to have that. Even some people would say, what would you like people tell you when your birthday at age 100, for example? Okay, I'm kind of cognizant of time, 12:40. So, and again, like why is important? Because it would improve our physical activity, reduce stroke, cardiovascular disease, risk of death, and healthcare utilization. And again, kind of would have better cost effective for our health care system. And kind of those would be helpful if we have that across our lifespan resiliency. So this is just a picture of that website, Healthy Minds, from University of Wisconsin-Madison, and they do lots of work. They do on teachers. They implemented kindness curriculum in school, and they created this Healthy Minds app. And I always recommend this to my patients. It's very nice, evidence-based, all about those kind of framework that I talked about, and ask you some questions at the beginning, which can show you whether you improved for after the practice. And the nice thing about this is it has different duration, 5 minutes, 10 minutes, 15, 20, 30, and also has kind of options of active or sitting, which you can do whenever you do dishes or different activities. And again, talks about the rationale and the neuroscience and neurocircuits that behind all of those framework that we just talked about. Talking about spinal cord injury, the reason that well-being is important, because we see depression in this population, almost 30%, and this is almost 3 or 4 times higher compared to general population. And anxiety, PTSD, substance abuse is higher in this population, and also suicide is higher. And we know that elevated, like research shows that elevated emotional and mental health difficulties in SCI can cause health complications, as we talked about, diabetes, heart disease, increased hospitalization, all those things that we just said, that those are related in able-bodied population, but also it's true for spinal cord injury. Definition of resilience. The challenge with spinal cord injury, like this is a definition that you've seen kind of maybe a bounce back from when people facing adversity, but this is definition also is nice, that talks about resilience is the maintenance of high levels of positive effect and well-being in the face of adversity. It's not that resilient individuals never experience negative effect, but rather the negative effect does not persist. So it doesn't mean that people who are resilient are always like happy and smiling, all those things. They definitely get sad or angry or upset, but it's not long lasting. And the challenge with the spinal cord injury is there is no definition yet. And the reason being, when people kind of have or faced with adversity in life, so some of the events happens and you know it passes. But with spinal cord injury is like they are continuously have recurrent problems with bowel issue, for example, wounds, or you know, all those other complications that they're dealing with. These are not just one event. It is one event that kind of impacts life significantly, but those kind of complications happening, and that's why it's not yet in literature that I reviewed that there is no definition yet, agreement on resilience in spinal cord injury. And again, before advent of before 1980s, before positive psychology, the science tried to explore that kind of dealing with why people, again, resilient or why people not, just answering why, looking at the kind of adverse or poor risk, the risk factors that causes poor outcomes, such as depression, anxiety. But now they're thinking that modern rehab or research should also pay attention to this, and now they are working on that as well. Again, if you want to look at resilience, it's kind of a continuum that at one side, some people had the higher extreme and they can bounce back quickly. What some others, which could be majority of people, actually research shows many people with spinal cord injury, they are resilient and they are kind of, they bounce back. But also some of them in the other end of, they have kind of, it's hard for them to deal with those adversity, and that crippled them. And so, for example, one of the predictors that some people would be resilient, more resilient, is if they could deal with small, minor things in their daily life, then that could predict that if something worse happens, that they can deal better with that, and they are more resilient. And again, if you think of how that would develop in kids, for example, or overall look at well-being and resilience as kind of a seesaw, when people have more positive experience and coping skills, they it is usually it's equal, like with positive and negative. And if they get the environment and nurtured, as we talked about, all those qualities, and the positive can overcome the negative outcome and make people more resilient, which can persist throughout their lifespan. And again, spinal cord injury, it showed that high level of resilience is linked to emotional regulation, coping, cognitive coping, which help with problem solving, and again, looking at setbacks, and they're able to overcome that, and positive mental health. And there again, that study is from that actually the same study that they found that high self-efficacy, the people who are resilient, they have higher self-efficacy, which means that they're more confident managing their own things, acceptance of disability. They have kind of fighting spirit and more spiritual, and not necessarily, I'm not talking about the religion specifically, but just being, more spiritual and satisfaction with life, and the adverse relationship with depression, anxiety, all those negative things. Okay, I need to finish quicker, go through this. And the important thing is just it's the when people are more resilient and they have those qualities, not just themselves, the effect has kind of ripple effect, like their family, friends, all those can be impacted by that. This is a study that in Australia done by nursing. Actually, they looked at this systematic review, and the themes that came out, like uncertainty and regaining independence, that's a big thing, and prior experience of resilience and adopting that resilient thinking, and strengthening resilience through supports. And they felt that nursing staff would have big role on that. Again, kind of there is a need and potential to have significant impact on self-efficacy in this population. There are scoping review done that is from 2020. They look at 40 studies, but again, at the end, like there are lots of heterogeneity, and there was just one interventional study that was CBT plus mindfulness, and again, because of the terminology, even the definition was not kind of consistent throughout. They felt that moving forward, the field need to look at more longitudinal research and kind of model-driven research. Very briefly, I talk about the program that we started. We initially started with mindfulness meditation program in 2018 or 2019 almost. And that was kind of 4 sessions, the same as resilience, but maybe last more than a year ago or so, we switched that to resilience group. And so what this kind of a group does, and again, the reason we changed that because we felt that they need to know more, as I taught, like, it's just not the mindfulness, but it is kind of mindfulness is part of this resilience program. 1 hour per week, and people go through some mindfulness and then group rules presentation. They talk about core emotions, how those relates, but what they feel, they get checked their emotions a couple of times throughout the session. Talk about acceptance. If they want to move forward, they need to accept, and that is a big one for people. And talk about wise mind and distress tolerance and emotional regulation. Again, they showed them those 6 core emotions, and they tell them this is like an elevator, and if they tell if you're at the top, like how they give number for each of them, and because people may have mixed emotion, that is easier for them to describe. And again, that is just showing how like reasonable mind or emotion mind would interact, and how they control, like maybe better to work on before acting, like use their wise mind, which is more reasonable. It kind of incorporates both emotion and reasonable mind. And these are some of the quotes. I'm not going to read for you. I give you maybe a bit to read it. And also, this is just talking about the group and how they feel they're not alone, that other people like them. Because I mean, people are in our unit, we have like 30 beds in our unit, but not all of them spinal cord injury, but people are so spread out, and even our room is just an individual private kind of room, and they are not seeing necessarily each other all the time, and that gives them kind of a sense of group as well. So what we have started like with COVID, all those things, and then with people changed quite a bit, and we had kind of interruption in our group program, but we're just finalizing the ethics, and we're gonna just do a small study, look at the program, 15 people with SCI injury or disease, and look their experience of this program, what are the strengths of the program. This is just a questionnaire of resilience, which is part of the quality of life questionnaire that is through Delaware University, and we got permission to use that. And so those are the outcome measures that we are looking at. And so the summary, awareness, insight, connection, purpose are 4 important pillars of well-being, and human flourishing depends on enduring these qualities. And I hope that I did tickle your mind a bit to pay attention to those qualities and try to see whether that could be incorporated in the program, in the rehab program. And this is definitely urgent need for not just our population, but and globally. I think that would be important. Oh, I have to show you this. What time is it? Just quickly. Oh, sorry.
Whistle bungee, here we go.
He's one of my patients, of course, gave me consent to show this. He was kind of polytrauma injury car accident a few years ago, and went to Vancouver for a wedding. I think bungee with family members except mom. Okay, cognizant, I'm going backward too. I want to finish here by this quote from William James, father of psychology. The greatest discovery of my generation is that a human being can alter his mind, his life, by altering his attitudes of mind. Thank you for your attention. And I put my 2 email address here if I'm happy to be contacted if there's any questions, and I'm going to take questions. I guess that's not much time left, but happy to answer. Let me just stop share here.
Okay, thank you very much, Dr. Askari. That was a great presentation and a lot to think about. So we have a few minutes for any questions that people may have. And feel free to either raise your hand, you can even unmute, or you can type your question in the chat. And while I wait for those, I can, oh, actually, Heather, here I have a question already. So Heather, go for it. You're unmuted, but we don't hear anything, or at least I don't hear anything.
Yeah, I don't hear.
If you want, you can also type it in the chat, and then I can just read it out loud as well. And while you are, do you want to try unmuting one more time? Okay, you're going to use the chat. Great. Okay. And while you're typing away, I guess I'll start off with a really quick question. For the intervention that you had, where they had the group resilience sessions for 1 hour per week for 4 weeks, it was the duration itself for the 4 weeks was just because of the duration that they are in the program itself. Is that the reason why 4 weeks was chosen?
You know, it is so hard, first of all, to even get that an hour per week of people to spend their time for this group. But also we thought that, you know, people since like a few years ago when the duration length of stay changed, we just use it arbitrarily, I would say, not necessarily 4 weeks, but we actually just recently added a piece, which we probably need to put another addendum for our ethics. What we are actually brilliant idea by our spiritual care provider now and behavior technologists that they run the program is to bring individual with spinal cord injury to kind of give their experience, and they invited the Spinal Cord Injury Ontario. They came and they're going to incorporate that, and people's feedback was really helpful, and they really enjoyed. And actually, they want maybe people with different age group to come. Like, you know, we had a young person came, but also I think we get that, because that tells you how people are worried when they are in acute rehab hospital, and they're thinking in the community what's going to happen, all those things, which I think having someone external would be very helpful to get that incorporated. And again, goes with the sense of support and connection and what we talked about well-being. But to answer your question, not necessarily specific, but again, duration would work with the length of stay.
I see. Okay, interesting. So I'm just reading Heather's question. So she says here that she thanks you for your talk and thinks that this is so relevant, also mainly to teach young children to be more mindful. And I think her question here is, with this data, have you seen more change to post-rehab therapy is the question.
More into post-rehab. You mean in terms of change of like with the mindfulness, or with the overall, with the resilience? Or sorry, I'm not clear at the question.
That's a good question in terms of what change that you're asking about, Heather, or maybe change in how therapy is delivered, or the quantity of that, maybe.
Yeah, there's another, is there?
Actually, I would say follow-up and therapy as a whole. So whether you've seen changes in terms of follow-up or therapy.
Yeah, so that's what we are going to look at, to see overall what people's experience, or do we see any difference in this program, but based on the questionnaire. And there is no cutoff for the questionnaire that I show you, that's a Likert kind of scale, and there is no cutoff or normal or not normal, but we can just follow them before, after, and see what we could see. But even short kind of interventions, some of those mindfulness intervention, they show kind of even with short duration some differences, which we can look at that. We'll see.
Okay, I'm mindful of time, so we'll just take one more question, maybe
Sure.
A 1-minute answer to this last question from Tess. And her question is whether there is an app that helps you assess the well-being of rehab patients, for example, stroke patients or concussion patients. And she says that this will be helpful for clinicians or care providers to assess the well-being of their patients.
Yeah, so I am not aware of it specifically for stroke or concussion. As I said, this app is Healthy Minds, is recognized the most popular one that used by New York Times in state, overall, I believe globally. And they did a study actually on their app and the effectiveness of the app on well-being. And so that's and the nice thing about this app is for free, for download. So it is, I definitely encourage you to just have a look. You will enjoy it, and then get you to practice on different things when you listen. It's just not kind of, close your eyes, do some breathing, all those things, which definitely important, but gives you a skill. Okay, you see a stranger, just wish him kind, like be kind, like in your mind, wish him happiness, or free of suffering. That sort of things that helps with your mind to be kind or compassion towards others.
I see. Thank you. Okay, excellent. So thank you for the talk, Dr. Askari. Thank you for those who are still here. And just to let you know that next month, we will, for the Jousse lecture, we will invite Dr. Taryn Aurora, who will be presenting. The topic is to be announced. So once again, I thank you, Dr. Askari, for presenting today, and for everyone who else is still here. If you have any suggestions for future presenters or topics, please email me. So I'd like to thank you once again, Dr. Askari, for a wonderful presentation.
Pleasure. It was great. If people have questions, I'm happy to email me. Thank you very much for this.
Thank you. Thank you.